Okay. Thank you, Madam Chair and other distinguished members. And thank you to the committee for allowing me to step in and testify briefly. My name is Greg Tarasidis, and I've been practicing for about almost 24 years in Greenwood, South Carolina, a rural part of the upstate. And I'm testifying on behalf of the South Carolina Society of Otolaryngology, Head and Neck Surgery, and the South Carolina Medical Association. As an otolaryngologist or an ENT, an ear, nose, and throat head and neck surgeon, we handle all medical and surgical issues above the collarbone, including ears, hearing, swallowing, and voice and speech. We work with our audiologists, we work with our speech pathologists to help our patients, and we help direct care to assure that no medical or surgical issues need to be addressed. With that said, we do have 4 concerns about the compact language, 2 of which have been addressed by others, but we're concerned that there's conflict within the compact on what actual meaning is. Right now, South Carolina has 3 other compacts: nursing, emergency medical technicians, and physical therapy. This compact contains language that states that all laws in the member state in conflict with the compact are superseded to the extent of the compact. And I reference you to section 40-67-640B, which concerns us. Now, the previous speaker mentioned where other places it may say something different, but we would present that that is a conflict that we have a hard time resolving. Because essentially this language would relinquish the authority of South Carolina to define the practice of audiology and speech language pathology. The other compacts that we have do not contain this language. This alone should concern the committee as it does concern us. She states that the South Carolina scope or the licensing is compatible, as they state, with what the compact says now, but the authority to define what is practiced is left to the commission, to the compact. So changes at the compact level would then affect the South Carolina level. Second, it requires member states to recognize the right of an audiologist and speech language pathologist to practice telehealth. Telehealth was presented as a way to perhaps fill labor shortages. I find that a difficult proposition as a physician, as speech and language pathology and audiology are very much a face-to-face and personal approach. The compact states that telehealth to be practiced by the audiologist and speech language pathologist would be according to rules promulgated by the commission. Telehealth in our state was enacted through a very tedious legislative process, and it set forth a very specific practice, documentation, and licensing requirements. And under this compact, South Carolina would delegate that telemedicine authority to an out-of-state commission to define how telemedicine would be practiced by audiologists and speech and language pathologists. We also have scope concerns, scope of practice expansion concerns. On the federal level, the academies of doctors of audiology continue to lobby Congress for an expansion in their scope. With the consolidation of licensing and compacting, this is used at the federal level, and there's nothing to think that this would not be brought to South Carolina to do the same. If there's going to be any change in scope, it should be because the state of South Carolina decides to do so, not because of an out-of-state commission. And lastly, the commission rules are not yet fully developed. The rules of the commission are not yet fully developed. By passing the compact, South Carolina agrees to be bound by them and that they supersede state law. Again, some conflicting testimony on that, but I would state that the compact, since it contains conflicting statements, may in and of itself not be ready to be adopted by South Carolina. It's difficult to get out. As she says, the 6 months to get out of the compact is to allow no patient abandonment. We would agree with that. We have no qualms about it. The part that got glossed over is that if we were to become dissatisfied with the compact or disagreed with its rules, it would require us to pass new legislation. That in and of itself is a tedious process before the 6 months would even start. So it's not a statement that just you would like to terminate. It requires new legislation to do so. So in conclusion, I want to stress that the present system of licensing that we have now is not broken. Could it be faster? Sure. Do we have labor shortages? Sure. But this is a proposed solution looking for a problem that does not really exist in our state. Labor shortages do not feel will be resolved by this. We still have trouble getting audiologists and speech and language pathologists to the state, whether they're licensed at a compact or would be licensed here. That's not really the issue. It's the ability to draw people and the shortages in the labor market itself. The compact, and the second point, the compact does relinquish state authority according to the compact to a commission operating outside of the state control. And for these reasons, we would urge not passing H 3840 at this time. Perhaps more study of it for the future could be addressed. We thank you, and I'll answer any questions before running back to the office. Thank you.
Are there any questions? Thank you, Dr. Tarasidis.